Hi everyone. In today's clip, I will talk a little bit about osteoarthritis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. Osteoarthritis, or OA, is the most common type of arthritis or inflammation of the joints where the ends of two adjacent bones meet. Those with osteoarthritis typically have joint pain or stiffness that most often is caused by damage to the cartilage, the slippery tissue that covers the ends of the bones in the joints. Other common symptoms include swelling around the joint area, clicking or cracking sound when the joints sort of bend, a reduced range of motion, muscle weakness around the joint, and etc. Osteoarthritis can happen in any joint, but it most commonly affects the joints of hands, hips, and knees, as well as lower back and neck. Every normal, healthy joint has a cartilage, which is a firm, rubbery material mostly made up of a gel-like substance with a high water content and two types of proteins, which is collagen and proteoglycan. So cartilage serves as a shock absorber that allows bones to slide over each other when a joint bends or straightens, and that they're in place to sort of absorb the shock. Because of its water content, it can change shape to absorb impacts when it's compressed. In those who have osteoarthritis, the cartilage loses a lot of its water content and deteriorates, reducing its ability to absorb the shocks. Without this cartilage, the bones underneath can rub together or against each other, causing pain and inflammation at the joint. So osteoarthritis is either primary or secondary. Cartilage breaks down in both types, but the difference between the two is the underlying cause of this breakdown. For primary osteoarthritis, which is more common, is the wear and tear type of osteoarthritis that develops over time without a specific cause that they can pinpoint. It affects women more than men, especially after menopausal age, and most often primary osteoarthritis affects the fingers, spine, hips, knees, and big toes. Secondary osteoarthritis has a specific cause other than normal wear and tear. For example, young people can get secondary osteoarthritis if they're athletes who use their joints a lot, or if they have jobs that require the same bodily movements over and over again. Various medications are prescribed for this condition, such as NSAIDs, as well as analgesics or pain relievers, including acetaminophen like Tylenol and opioids, corticosteroids, the antidepressant duloxetine, and anti-seizure drug like Lyrica. Then they have topical creams like capsaicin cream or lidocaine, and so on. I also know that they've been working on introducing few new medications, but I'm not quite aware of how far they are in this right now. An anti-inflammatory, for example, antibody medication is one of the things that they're working on. Injections of adenosine, actually triphosphate, to help regrow lost cartilage. Injections of novel molecule blocker to halt the cartilage destruction, and growth factors delivered via nanoparticles to regenerate cartilage. Again, I don't know how far they have gone in these. Currently, conventional medicine does not support the idea that this ailment can be healed. On the orthomolecular medicine side of this, since the early 1940s, they have successfully used niacinamide to cure this ailment. Please remember, anytime you're following a natural therapy, it will take some time for the body to come back to its normal state. Some people say it will take 20% of the time you were not feeling well, and that is the amount of time you need to heal. I feel even if the symptoms go away within a few weeks or months, we need to continue for at least 7 years for a complete renewal. Anyhow, niacinamide in frequent divided doses daily, but in regular intervals is required. So normally 250 milligram is taken every 3 hours up to 4,000 milligrams a day. This is the divided doses that actually works. Don't use niacinamide, which is manufactured in hard gelatin capsules. They do not release niacinamide at the rate that is required, and some brands of niacinamide have preservatives, coloring, etc. in them to increase their shelf life, but some people have severe adverse reactions from taking them. So read the labels first and do some homework. Niacinamide has ungated access to the brain. When it enters the brain, it has a strong affinity for the benzodiazepine receptors and causes a desirable calmative effect. But it also improves other functions of the central nervous system. Added to this is vitamin C in doses of 2,000 to 3,000 milligrams a day in divided doses, and of course a good multivitamin for the base. Also, 3 to 4 grams of gelatin a day is very important. You can buy this in health food stores. Make sure that the gelatin is clean and is pure gelatin. And you can even use Knox gelatin that is in the baking aisle of every supermarket pretty much. Other natural suggestions for healing are lifestyle modifications such as weight management, because excess body weight puts significant stress on weight-bearing joints like knees, hips, and spine. Getting rid of even a small amount of weight can dramatically reduce pain and improve the mobility. Also, regular low-impact aerobic exercises like walking, swimming, cycling, and water aerobics are excellent for cardiovascular health and joint flexibility without excessive stress. Strength training for strengthening the muscles around the affected joints to provide better support and reduce strain. Flexibility and range motion exercises like gentle stretches and movements which can help maintain joint flexibility and reduce stiffness, like gentle yoga or Tai Chi. Most importantly though, listen to your body. Avoid exercises that can cause sharp pain or worsen the symptoms. Warm up and cool down before and after the exercise. Try to alternate heavy tasks with lighter ones. Take breaks and use assistive devices like canes and walkers when needed to reduce stress on the painful joints. Heat and cold therapy are also good. For heat, moist heat is often best. This can relax the muscles, ease pain, and improve blood flow. Use warm compresses, hot showers, baths, or heating pads. Cold can reduce swelling and relieve muscle aches, especially after activity. So you can use ice packs that are wrapped in thin towels, for example. Follow an anti-inflammatory diet and focus on foods that reduce inflammation in the body. This generally includes fruits and vegetables, which are rich in antioxidants, especially colorful varieties like berries, cherries, leafy greens like spinach and kale. Omega-3 fatty acids found in fatty fish, salmon, mackerel, sardines. Sardines are more of my favorite than the other ones. Flaxseed, chia seeds, and walnuts. Opt for whole, unprocessed grains over refined ones. Use lean proteins like fish, poultry, beans, and lentils. Nuts and seeds are good sources of healthy fats and nutrients. Limit, and if you can, completely stay away from processed foods, sugary foods and drinks, and unhealthy fats. These can promote inflammation and pain. Drink plenty of clean water throughout the day and add few grains of good sea salt to the water that you're drinking for better absorption. Herbal remedies and supplements which can be helpful are turmeric and ginger, Boswellia serrata, which are considered strong anti-inflammatories. Also glucosamine, chondroitin, MSM, and SAMe. These are components of cartilage, as well as, other than SAMe, they're component of cartilage, as well as they reduce pain and inflammation. Vitamin D3 and K2, important for bone health. And some research suggests a link between vitamin D deficiency and OA progression. Supplements and herbs also can interact with medications, so make sure that you always consult your doctor or pharmacist before starting any new regimen. It's important to mention that lymphatic system plays a crucial role in maintaining joint health, and its dysfunction can contribute to the progression of osteoarthritis. Specifically, the synovial lymphatic system, or SLS, which is responsible for cleaning inflammatory factors and waste products from the joints, can become impaired in OA, leading to a buildup of harmful substances and aggravating inflammation and cartilage degradation. I have a clip on lymphatic massage and drainage that you might want to sort of check if you're interested. On the emotional and metaphysical side of this ailment, this normally points to unresolved emotional issues such as anger, resentment, and grief. Chronic stress and anxiety and lack of a spiritual connection can also be contributing factors. Hope this has been helpful. Like and follow for more. Be the light.